Some of the life-changing procedures that we do here, we do cosmetic dentistry, where we can change smiles instantly. We've all seen, pictures and shows where smiles are changed and people cry, and those are things that truly happen because we can take a tooth and we can change the shape, the color. We can take smiles that are crooked or missing teeth or broken teeth, and we can reshape those teeth and do very conservative porcelain coverings on those teeth that can change people's lives instantly. We have people who haven't smiled for years or hide their smiles, and now they come through the door now and you see them big smile on their face, and it's that's such a rewarding thing to see in those kind of procedures. But what we do with those is we look at a smile. We take a lot of photographs of that smile. We take impressions of that smile, and we go in and we reconstruct the smile before we do anything with it. We do what we call wax up, and that's kind of our blueprint for that procedure. So once we have kind of an idea of where we're trying to change that smile or change that bite or things like that, we have that reconstructed in a three-dimensional model, either a computer model or a live wax-up model where we wax the teeth in with the technician. And then the patient, the guest, can look and see where they have changed that smile. They can see what they're going to look like before we do anything. And then we schedule the procedure. We get the teeth numb. It's a very comfortable procedure. And we go in and we change the shape of those teeth. We reshape some of those teeth, remove old fillings or cracked teeth. Or if teeth are missing, we place implants that same day. And then when they leave that day, we use that wax up, that three-dimensional model to make some teeth, even though they're temporary teeth, but it gives us an idea. It's kind of like a dress rehearsal of what their real teeth are going to look like. They leave that day, but they're going to have a vision of what their new smile is going to look like. And that's usually when they're the most emotional, because they see that and they see, wow, this is amazing that we can do this so quickly. We often use a laser to change, to raise some of the gum tissue or change some of the gum architecture so that the smile is framed correctly. A lot of the teeth you'll see straight teeth, but then gum lines are crooked, and those are things we want to make sure all that flows very perfectly through the smile. So once we've done that, they come back the next day. We take a lot of photographs, pictures, and just make sure that we've done everything correctly, that it looks right, and that before we go into the final porcelain. In the meantime, the porcelain's being constructed, and a couple weeks later they come back and we bond those restorations in, and they leave with a perfect looking smile. But there's lots of checks and balances kind of along the way to make sure that that procedure is perfect.